Full mouth reconstruction is replacing all of the patient's teeth with implants and a prosthesis in order to be able to chew normally. There are multiple options for full mouth reconstruction. You can place multiple implants, such as 2 implants for an overdenture to support a denture. You can go to more implants, such as 4 implants in order to place a prosthesis, such as a denture. Or you can do 4 implants and place something rigid, which is not removable. The best candidates for full mouth reconstruction are patients that either are in full dentures already or have a lot of missing teeth or have a lot of bad teeth that they need to replace. Many patients can benefit from having something that is fixed and not removable from their mouth that gives them the ability to smile and chew without feeling uncomfortable and not having to deal with the recurrent failure of multiple restorations in their mouth. If you feel that you've been told that your teeth are failing or that you're wearing a denture and you no longer want to have something that you have to take in and out of your mouth, please feel free to call the office to make a consultation appointment. We can tailor-make a plan to fit your needs.